What if I told you that the way we treat kidney diseases could also be harming the planet and possibly you? Welcome to the world of Green Nephrology, where healthcare meets sustainability. Hi, I'm Dr. Rehan Pradhan, MD Internal Medicine, and today we're diving into an emerging concept about kidney care that focuses on reducing its environmental impact. Nephrology, the branch of medicine dealing with kidney health, relies heavily on resource-intensive treatments like hemodialysis. Dialysis is a life-saving treatment that removes waste, toxins, and excess fluids from the blood when the kidneys can no longer do it effectively. But no healthcare practice is as profligate with resource consumption as is dialysis. Research shows that it can cause wide damage to the environment through massive water and energy uses, production of plastics, and carbon emissions. Just 1 year of dialysis for a single chronic kidney disease patient can generate up to hundreds of kilos of plastic waste and consume thousands of liters of water. An average 500 liters of water used in each 4-hour session makes a single patient use nearly 80,000 liters of water every year. Now imagine that multiplied by millions of people worldwide. Dialysis consumes a staggering 150 billion liters of water globally, most of which is flushed into the sewage system. Each session produces about 2.5 kilos of single-use plastic waste in form of tubings, dialyzer, bottles, and syringes, creating 500 kilos of plastic pollutants from every patient per year. Hence, while much of the world thirsts for water, all of it is drowning in waste. We are largely ignorant of the environmental footprints we leave behind us. We neither know nor have seemed to care. Healthcare is actually a significant contributor to global carbon emissions, with dialysis alone accounting for half of the healthcare's carbon footprints. A carbon footprint is a measure of greenhouse gas emissions like carbon dioxide, methane, and nitrous oxide. Annually, carbon dioxide emissions per dialysis facility are equivalent to emissions from the annual energy use of 93 households, and a single dialysis treatment emits as much carbon dioxide as a 238-kilometer car drive. The largest contributors to total emissions are patient and staff transportation, electricity, and natural gas, primarily used for heating water and powering water purification. Not just kidney care is hampering the nature, but climate change and pollution also harms the kidney, creating a vicious cycle. The kidneys are exceptionally susceptible to extremes of temperature, making them a direct target of global warming. Moreover, as the kidneys filter the blood, they are also exposed to the potential harms posed by microplastics ingested through food and water. Several epidemiological studies suggest that ambient fine particulate matter is associated with increased risks of incident chronic kidney disease and progression to end-stage kidney disease, meaning requiring lifelong dialysis. Recent experiments in rodents showed structural kidney injury and prolonged exposure to exhaust particles, meaning air pollutants can directly damage your kidneys. Sadly, the burden of climate change and environmental pollution disproportionately affect low and middle-income countries. They have a high burden of kidney diseases and are facing an increasing demand for dialysis. Building awareness of the sheer scale of environmental impact is the first step towards identifying opportunities for improvement. Central to these approaches is renewed focus on prevention that avoids or delays the need for dialysis. However, prevention is only a part of the solution. When we talk about environmental footprints of healthcare, we also need to consider about two-way relationship between people and the planet, the vicious cycle of kidney care and kidney diseases. That's why green nephrology is gaining traction. It's all about reducing the ecological harm of kidney care without compromising patient outcomes. This includes planet-friendly solutions like switching to renewable energies in hospitals, reducing single-use plastics whenever possible, reusing dialysis water like redirection to autoclave services, janitor water, or toilet flushing, or for landscaping use like in Morocco, redirection to aggregatory use has been practiced for decades, while in rural Australia, local food production has been dramatically augmented by RO reject water capture, repurposing waste like dialysis filters used in water purification, and also regular kidney health screening, especially diabetes and hypertension, and preventive measures through lifestyle, diet, exercise, and medication. Expanding access to kidney transplantation, which has up to 90 to 95% lower environmental impact than dialysis, adopting innovative low-carbon dialysis practices, and sustainable thinking at every level of care. These measures are realistic and possible. The only limit is our imagination. Although the challenges are significant, innovation and new research is beginning to shape a roadmap for a more sustainable future ahead. As we all become more aware of the urgency of climate crisis, healthcare and every one of us has vitally important roles to play. Green Initiative is more than a trend. It's an eco-friendly movement towards a healthier planet and healthier lives. If this episode got you thinking, give it a like, subscribe, and let me know in the comments what can we do to ensure a sustainable model of kidney care. Until next time, stay green and stay healthy.